Good afternoon, Professor Lilly and Spring 2024 Beckley ADN program. My name is Colton Caskey, and we're going to be doing my health promotion presentation, and it is on atrial fibrillation, so feel free to follow along with my PowerPoint. I feel like this is going to be a great learning exercise, and it might help a lot of you on your NCLEX, especially if you struggled with cardiovascular diseases, this specifically atrial fibrillation. So let's get started. So atrial fibrillation, what is atrial fibrillation? What is the pathophysiology of it? Well, atrial fibrillation, also known as AFib, is an irregular and often very rapid heart rhythm. It's an irregular heart rhythm called an arrhythmia. AFib can lead to blood clots in the heart. It can also increase a patient's risk for stroke, heart failure, and other heart-related complications. Looking into the pathophysiology of it, the most accepted pathophysiology of AFib is now thought to involve an interaction between initiating triggers, often in the form of rapidly firing ectopic foci located inside one or more pulmonary veins, and an abnormal atrial tissue substrate that's capable of maintaining the arrhythmia. And as you can see below, I have a graph of what AFib looks like on an EKG reading. Moving over to clinical findings. As a nurse, what are we looking for in a patient that has AFib? Well, the presentation of AFib can range from asymptomatic to even devastating complications such as cardiogenic shock and stroke. A complete history should focus on symptoms such as palpitations, shortness of breath, dyspnea, dizziness, increased lower extremity swelling, and chest pain. And as you can see that graph below, that's a great graph to look at before you're taking your NCLEX. I think it's a really good way to memorize it. It's very bright and colorful. Moving on to diagnostics, how are we going to officially diagnose atrial fibrillation? Well, an EKG, or known as an electrocardiogram, is the most important test to use when you're diagnosing AFib and atrial flutter. An EKG is performed by placing small, painless electrodes on your patient's chest, wrist, and their ankles. The test will be performed while at rest, or in the case of a stress exercise, while the patient's walking on, say, a treadmill. Now, below I have a graph that will not only show you what atrial fibrillation looks like, but many other common heart diseases that you're going to see in working in the field as a nurse. I think this is a great graph to study before your NCLEX and to just memorize. So let's move over to medical treatment. Medications to treat AFib can include many things. Most commonly, rate control medications to prevent the ventricles from beating too fast is what the patient's going to take. Examples of this could range from metoprolol to Ramapil, daltalazam, and even digoxin. Rhythm control meds are going to help your patient's heart beat in normal sinus rhythm. And that's really the main goal when we're trying to treat AFib, is to make the heart beat at a normal, healthy rhythm. Now, moving into complications. What are the complications that your patient might experience with atrial fibrillation? Well, there are many complications with AFib. It can cause troubling symptoms and even serious medical complications. Blood clots and stroke and even heart failure are a huge issue with patients that have AFib. It's also noted that thromboembolism in many vital organs in the body, your lungs, your kidney, spleen, liver, limbs, and intestines are all susceptible to thromboembolism. Heart failure, heart attack, some other acute things such as acute pulmonary edema, and chronic things such as dementia. That's going to be seen more commonly, like I said, in chronic AFib, mini strokes caused by microemboli, and AFib can even result in ventricular fibrillation, which that in itself can lead to your patient entering cardiac arrest. So this is a very serious disease, and it must be taken seriously and monitored adequately. Now, let's go into nursing interventions. What are you as a nurse, what are you going to do when you suspect or are dealing with AFib? Well, first, you're going to want to obtain a 12-lead EKG. You're going to want to measure your patient's vitals. If they're unstable, then your patient may need a cardioversion. That's why it's so important to manage your patient's vitals whenever they are diagnosed with AFib. Hook the patient up to a cardiac monitor. It's very important to see what that heartbeat's looking like and what rhythm it's in. Administer drugs as prescribed by your provider. Also, further to mention, anticoagulants is a common therapy for patients dealing with AFib, and you're also going to want to check your patient's neurovitals. You need to make sure their neurosystem is good and that they haven't suffered from a stroke, because as previously mentioned, stroke is a common side effect from AFib progressing. So moving on to patient education, what can we teach the patient about AFib? This is very important when addressing the NLN competencies of nursing and AFib, particularly for your patient. So let's teach our patient some non-pharmacological methods of treating and keeping under control AFib. Your diet. Diet is a huge part in heart disease, not just atrial fibrillation, but all heart disease. Going on a healthy fat, low sodium diet is very helpful with patients that are suffering from AFib. Avoiding trans and saturated fats and maintaining low sodium intake helps your body control its blood pressure and its cholesterol levels. It also helps protect your blood vessels from clotting and becoming congested. Caffeine. Americans have a serious caffeine problem, especially the younger generation. You need to watch how much soda, coffee, chocolate, and sweet tea, energy drinks is huge that you're consuming, because that'll make your heart race, and we do not want the heart racing due to caffeine when we're dealing with AFib. Alcohol. Alcohol is a huge issue with patients who have AFib. Large amounts of alcohol can set off AFib. It can actually trigger it. It also needs to be noted that, like I mentioned before, blood thinners, alcohol can make a blood thinner work too well, and it can make the patient bleed far too easily. You also need to discuss with your patient vitamin K. If you're taking a blood thinner like warfarin, the brand names Coumadin and Jantavine, vitamin K is the antidote to that medication. If you consume in your diet too much vitamin K, it's not going to allow the blood thinner to do its job properly. Some examples of foods that are high in vitamin K are broccoli, spinach, and lettuce. Also, weight control, as well as leading that into exercise is a huge benefit in treating AFib. A healthy weight, healthy person that exercises a lot will be able to manage this condition much better. Smoking is a huge issue with not just AFib, but all heart conditions. We want to help our patient understand how beneficial quitting smoking could be, whether that is them doing it on their own or even helping them out with certain things like nicotine gum, and controlling your stress. Both pharmacologically and non-pharmacologically, stress is not good for the heart. We want our patient to know that. And if they have an issue with stress, as a nurse, we want to be able to help them the best we can. Okay, so I've assembled a little quiz for you guys. I'm just going to kind of go over. So it covers some of the stuff that we have just mentioned. So let's dive right in. Let's go into question 1. I'm going to give you a couple seconds to answer each question. Question 1. What dietary changes can be made to help with AFib? Is it A, decreasing your trans fat, B, decreasing your protein intake, C, decreasing your carb intake, or D, increasing your carb intake? All right, guys, and the correct answer is going to be A. You're going to want to decrease those trans fats. Trans fats are not good for the heart, so you're going to want to decrease those trans fats in your diet to be able to manage this condition better. Let's move on to question 2. So of the 4 options present, what is a common clinical finding of AFib? Is it going to be A, irritability, B, dyspnea, C, upper extremity swelling, or D, decreased temperature? All right, guys, so the correct answer to this is going to be B. Dyspnea is a common finding in AFib. Instead of irritability, you're actually going to see more of a dizziness, sort of confused conscious. Upper extremity swelling, no. AFib has a lot of lower extremity swelling. And your temperature, it's not going to decrease in AFib. So B, dyspnea, is the correct answer to this question. Moving on to question 3. True or false? Electrical cardioversion is an appropriate method to treat atrial fibrillation. All right, guys, the answer is true. Yes, you can shock AFib. AFib is one of the sinus rhythms that you are able to shock back into rhythm if needed. Moving on to question 4. Guys, true or false, smoking tobacco products does not affect someone's heart health? All right, guys, the answer to that is false. Smoking is awful for your heart. If you have heart issues, you do not want to smoke. You want to stop smoking as quickly and or as effectively as possible. And moving on to our final question. True or false, atrial fibrillation can be genetically caused? Guys, yes, the answer to that is true. There are many studies that show that atrial fibrillation can be a fact of genetic predisposition. So it's something that you want to obtain in your client's medical history whenever you are taking in objective and subjective data during your assessment. Guys, that concludes our quiz and it concludes the presentation. If you got an 80 or higher, meaning you missed one or no questions, I believe you're good to go and you have a very good understanding of atrial fibrillation. If you got more than one question wrong, I just suggest rewatching this video and going through the PowerPoint again to get a better understanding. But I really do think that with the work and information that I've provided here, that this will help you understand AFib very well. And if you understand this PowerPoint and the video I've done, I would say you're very ready to take on the NCLEX and you will get any questions about atrial fibrillation correct. So thank you guys for sitting through this with me. I hope you have a wonderful day.